Hello, welcome friends. This is Dr. Jaitly, your cardiologist on your favorite video site, MuniMeterHealth, which is dedicated to teaching you medical education and patient education in order to improve the clinical outcomes. That's correct. In fact, the outcomes are much better, improved. In fact, that's been shown across the world now with medical education, patient education, they are together combined. So this has been my deepest global initiative in the past 40 years in my practice here, and I certainly relish the fact that patients should be educated as much as the medical doctors, even though in very simpler terms. But the fact is that they should be aware about their illnesses. They should be aware about what their diagnostic procedures or tests that have been ordered, and of course the results that could be discussed, and then the therapeutic options that the doctors come up with. Today, as usual, without any further ado, I like to delve into the subject matter, and here it is. You see it: how to measure blood pressure. Now, this has been a very important entity. As we all know, blood pressure is well defined as a pressure within the arterial system that is prevalent in our cardiovascular tree, if you will. Now, we know our entire human body has bloods that's circulating around in every single organ of your body and every single square millimeter, if you can imagine, throughout your body, where millions and millions of arteries, veins, and capillaries, they constitute the so-called the circulatory highway, I call it. So the bloodstream is carrying the oxygen and the nutrients, and it's bringing in blood to the brain, it's bringing blood to the heart, the kidneys, and the liver. And of course, the heart is the major engine here. So that's pumping the blood, and the heart sits somewhere right in your left side of your chest, if you will. I can draw it here for you if you like, and the lungs are on either side. So this is a very informative video, primarily for patients, where I want to make sure that they understand how to measure blood pressure. So the blood pressure machines are equipped with a cuff, as you know. It's a blood pressure cuff, and of course it has a little dial here, and it has a little this is the dial which reads off the blood pressure. This is the pump, or a small little pump that through which you can pump air within the cuff. Now remember that the arm of the person should be at the level of the heart, or perhaps right at the level of the table, if you will. So and the person should be nice and relaxed, at least for 5 minutes. Make sure do not have coffee or tea prior to your immediate blood pressure measurement, because that's going to get your pressure abnormally high. And likewise, you should not just come running up the stairs, etc. So make sure you've been sitting for about 5-10 minutes, and then you check the pressure. So tie the cuff right in the middle of your upper arm, and about 1 inch or 2 inches above the elbow, and keep the arm as extended as possible. Again, not very stiff, but as extended as possible, just like shown here in this cartoon. Now, and it should be snugly placed in. So this is nicely snugly placed into your arm, right like that, as I shown. And the dial will start moving the needle up as you start inflating the cuff with the squeeze of this pump. So with the other hand, try to squeeze it. Make sure your stethoscope is already in your ears here. These are your earpieces, and obviously this is the flat of your diaphragm or the stethoscope, which you'd like to place in the inner end of your elbow. Okay. So hope I'm going fairly at a good speed so you guys can follow. So the cuff is tied. The dial is right here. The pump is now being inflated. The cuff is now being inflated through the air through this pump, and your stethoscope, the flat of the diaphragm, or the piece, the auscultatory piece we call it, is in the inner end of your elbow. Okay, and that's where the pulse is, the brachial pulse we call it. And as soon as you start hearing the first sounds, that becomes your systolic. Remember, as soon as you hear the heart sounds, that becomes your systolic pressure in millimeters of mercury. And when the sounds disappear, as you're starting to lower now this pressure, so start releasing it like 5 to 10 millimeters every few seconds, and as the pressure starts declining, you will have the sounds disappear, and the place where they disappear, that becomes your diastolic blood pressure in millimeters of mercury. Remember, so systolic is always higher because you're starting your pressure higher as you start dropping it, and diastolic is the lower pressure. So this becomes, say, 120 is your systolic, and your diastolic is 80. So your pressure is 120 over 80, and that is considered as normal. Now, what is systolic blood pressure? Systolic blood pressure implies contraction of the heart. That means the heart is now sending blood. Remember, your blood is circulating through the arteries here in a very pulsatile fashion. So it goes up and down. It goes up and down. So the systolic is up and diastolic is down. Systolic is up and diastolic is down. So it's like a pulsatile way the blood pressure traverses through your entire arterial system. So the contraction of your heart, remember, I'm writing it in a very hurried fashion here. Contraction of the heart is your systolic blood pressure, which is 120. And the diastolic is your relaxation. And I'll tell you, both are very, very important now. And that becomes your diastolic. So both are very important here, systolic and diastolic. And in fact, anything over 120/80 now, by the newer guidelines from the American College of Cardiology, say it's 130/85. Now that is considered as mild hypertension. Now no more leeway here. So 120/80 is the cutoff here. Anything over that is considered as abnormal, and therefore it's mild hypertension. Now blood pressure is hypertension is a silent killer, as we know. We know it's a silent killer. Why? Because it can damage the brain. It can result into a stroke. It can damage the heart and cause a heart attack, or even heart failure. And it can damage the kidneys and result into CKD, we call it, and that is renal failure. And liver, of course, can get enlarged as well. So all these vital organs, basically, they suffer a target organ damage, because a lot of people ask me, what is blood pressure? I said blood pressure is a number, but the fact is that it's the number which is responsible for all these damages that tend to occur in all these various organs. And these are the vital organs you want to protect. It's like your car. You have a sign that comes on the dashboard, and then if you don't pay attention in time, the chances are something is wrong going to happen with that car. It's the same thing here. Ultimately, blood pressure is only a number. But my friends, it's a silent killer, and I always say, make sure, be leery of the fact that go and see the doctor if your pressures are over 120/80. Okay, you must go and see your doctor and have your pressures checked, because that's where you can prevent all these damages in these various vital organs. Okay, so just a quick video on how to measure blood pressure, why is it important, and what systolic and diastolic is, and of course what the target organ damages that you can prevent by treating and going and seeing the physician, and have your pressures checked at least 3 or 4 times a year, especially if you're in normal good shape. But if you are already taking medications for high blood pressure, then of course you must check it every week, okay, in order to have it nicely followed and maintain a chart and bring it to your doctor. Thank you again for your attention, and stay well and stay on MuniMeter Health.